Hi, I'm Joseph Wells Henderson at the University Hospital's Urology Institute here talking about the Cochrane Review of Mid-Urethral Slings for the treatment of stress urinary incontinence. So this is a big problem. Urinary incontinence affects about 50% of all women during their lifetime, and 50% of those will have stress urinary incontinence with a cost of about $13 billion annually. This is a review of 81 studies encompassing about 12,000 different women, looking at the differences between trans-obturator tapes and retropubic slings, and from an in to out and out to in, top to bottom or bottom to top approach. The study is all-encompassing from 2014, looking on back. And what the conclusions were from this, that both these slings, both trans-obturator and retropubic slings, are very effective, in the ballpark of about 80% for both at 1 to 5 years, and long-term studies looking out greater than 5 years report about a 70% improvement, subjective improvement in stress urinary incontinence. Now, the study did look at the differences between the two types of slings, and the main differences are cost effectiveness. Trans-obturator slings appear to be a little more cost effective, but that comes at the price of potentially higher rates of groin pain with the trans-obturator tapes. Furthermore, there appears to be higher reoperation rates for stress urinary incontinence with patients that have trans-obturator slings. Looking at the retropubic slings, it also appears that a bottom to top approach, as opposed to a top to bottom approach, appears more efficacious, meaning that it lasts longer with fewer injuries to the bladder and the urethra. So, in conclusion, mid-urethral slings are very cost effective and very effective in the treatment of stress urinary incontinence. So, that's the end. You're in the know.